Good afternoon, everyone. I'm Dr. Teh Chee Ming. I'm a consultant pediatric neurologist. Basically, I'm dealing with children with a brain as well as a nervous system problem. Of course, one of the important encounters I meet is about fixed and funny turn in children. And that's the reason today I would like to share with you all about this topic. Okay, what is fixed and funny turn in children? In fact, these events are not uncommon in children. Even though we call it as funny turns, it is actually a funny, strange event, but of course not funny, amusing events. Usually these events happen fairly suddenly and quickly with a rather fast onset. And in fact, it is really not funny to parents and it's really frightening experience and it may actually create much worry to the parents when this event happens. Some parents even thought the child is going to die during the episodes. So that is actually very important as parents. We need to know what exactly it is and what should we do during the event. So if you look at this chart, most often the fixed and funny turn commonly present as two ways. One of it is as an abnormal movement and of course the other as an abnormal awareness as well as consciousness. So when this child presents with abnormal movement, it can be in the form of jerks or shaking movement. It can just fall to the floor, or sometimes they may have stiffening of the leg or even the limbs or even the hands. Occasionally, they may have other movements such as blinking of eye and also clenching of teeth. Other than this, the other common presentation of fixed and funny turn is about the abnormal awareness or consciousness. They may just present with actually a blank spells, and occasionally they may just loss of consciousness or awareness. And definitely all this event is really actually scary to observe for the parents. And the first question when a child presents with abnormal events or funny turns, doctors may ask whether this is fixed or not. In fact, based on a Danish study shows that up to about 40% of these events in fact are not fixed. And there are many actually emitters that can mimic fits. Among these listed below, including loss of conscious emitter like syncopal attack, which you have a fainting episodes, or it may be related to some behavioral emitters like the conversion problem, or sometimes like sleep emitters like night terrors, nightmare, or sleep jerks. Occasionally, some movement emitters like tic disorder may present similarly as well. Of course, sometimes migraine with aura may actually present almost like a funny turns. To understand what is fits, it is very important for us to understand about the nervous system. Basically, our nervous system consisted of three important structures. The brain, it joined together with the spinal cord, and also we have this nerve. Basically, all these structures work together in processing the senses from externally, and also at the same time, it controls the body, the actions of the body. And if you look at this, is actually basically the cross section of our brain. Inside our brain, there are billions of nerve cells we call neurons. Of course, there are many so-called synapses, which is a connection between the nerve cells conducting electrical activity every day in and out, whether you are awake or sleeping. And when you have a transient disturbance of the electrical activity of the brain cells or nerve cells, this will cause excessive discharges in the brain. I always like to equate it as an electrical storm in the brain. And this will lead to what we so-called fits or convulsions or seizures, whatever you want to call it. And how are the presentation of these fits? As we know, our brain basically controls many functions. And during the electrical activities in the brain, it may present as either an abnormal movement, it can present an abnormal sensations, and also sometimes it will cause the impaired awareness or responsiveness, and also change of behavior and emotions. And these are among the common presentation of fits. So if we have confirmed these abnormal episodes of funny turns are fits, the next question always a children doctor will ask is whether the fits are associated with fever or without fever. And the common cause of fits is actually in the context of fever are febrile convulsion, or we call febrile fits. But important to remember that not all fits with fever are febrile fits, because febrile fits actually happen in a certain age group of children. For example, children between 5 to 6 months up to 6 years. And at the same time, it's very important for us to make sure there's no brain infections or other brain problems. And also there's no presence of any body chemical derangement. And owing after we are excluding other causes, from there, if the doctor convinced fever is the only cause of the fits, then only we can confidently say this is febrile fits. At the same time, it is equally important for us to identify and also treat the underlying cause of the infections when a child has febrile fits. One of the things, as I mentioned just now, when a child we have fits in the context of fever, it's very important for us to exclude brain infections. And this is one of the procedures most of the parents may be worried about, called spinal tap or lumbar punctures. In fact, this is actually a very useful test for us to carry out to actually make sure there's no infections in the brain. And many parents may worry because that may cause long-term effect like inability to walk. In fact, by careful selections of the patients and with the careful monitoring during the procedure, this test or this procedure is safe. The commonest probably the complication may arise probably some headache or probably the back pain. Otherwise, other serious complications are pretty rare. After we have actually looking at the fits with fever, of course now we need to look at fits without fever. And these are among the important causes of a fits without fever. It may range from a brain abnormality to a body chemical derangement to a genetic disorder, or it might actually be because of antibody mediated by which the antibody may be attacking our brain. And of course, in a benign conditions, probably it's just a self-limited, or we last time used to call idiopathic epilepsy. But occasionally, after very extensive workup, we may find no explainable cause for it as well. So always parents may ask the questions, when a child has fits without fever, will it equate to epilepsies? Yeah, epilepsy literally just means to us that if the brain has persistent tendency to cause a repetitive fits, which means that when you have a recurrent fits, 2 or more episodes, plus unprovoked fits, which happen without a triggers, then this child may be labeled as having epilepsy. And what will the doctor do? Essentially, when you come to doctors with a complaint or with a child complains of funny turns or fits-like movements, doctors may need to take a detailed history from you and of course from the eyewitnesses. At the same time, it's always advisable if you can actually capture the event using the videos. And nowadays we have so many electronic gadgets that you can actually take the videos of the events. It is always important because sometimes when you actually narrate the story to the doctors, it may not translate the similar things into the brain of the doctors. So the video itself will help the doctor to interpret the events very carefully and also accurately. And after that, definitely your child will be examined thoroughly by the doctors as well. So what are the important history perhaps the doctor may get from you? And it's always very important for you to prepare the answers when you come to see the doctors. And first of all, we just look at the events. We need to have a very detailed description of the events. If there's presence of any abnormal movement, please tell the doctor exactly what are the patterns of the movement. Is it involved left or right side or both sides? Any body parts involvement? At the same time, whether the child is responsive to you during the events. Of course, it's also very important to tell the doctor whether this episode happened just once or in a groups. And also it's very important how frequent were the episodes happening, whether it's daily, weekly, or monthly, or how many times a week. At the same time, it's also very important to let the doctor know whether it happens when the child awake, sleep, or awakening, and also how long usually this event will last. Besides that, it's always very important for you to observe what exactly the activity of the child. What was he doing or he or she doing? Whether there's any abnormal behavior or sensation, as we call aura before the episodes. And also it's good to notice how were the child conditions after the events we call recovery period, whether the child recovered very quickly, whether the child having weakness after the whole event. So next, after getting good history examination from you, doctors would like to actually perform some tests, and it depends on case by case basis. These are some of the tests that doctor may suggest, which include some of the blood and urine test, an EEG, a brain scan. I will try to illustrate a bit more about the EEG and brain scan in the next few slides. So what is an EEG? Parents may worry whether this EEG is a test or is a procedure which is invasive. When we say invasive, it means whether it cause pain to the child. But literally, this is actually very safe and actually so-called non-invasive because it causes no pain at all in the child. So what actually we are doing during the procedure is that we are actually placing the electrodes of this wire onto the scalp of the child. And it involves no transmission of electrical activity in the brain, no. It just basically try to record how was the brain activity or how was electrical activity in the brain. And it's always good, a neurologist or doctors will try to actually get both the child awake and also the sleep records. And literally the EEG will help the doctor to support the diagnosis of epilepsy, to identify the types, and of course sometimes we use it as a monitoring as effect of the seizure medications. So this basically just to show you very quickly how the brain activity will look like, and this is how the EEG record will look like. And this is actually a normal record. And this just show you an example when you do the EEG, there's actually an abnormal records. So next about brain scan. And when we do the brain scan, because as I mentioned just now, one of the cause of the fits, particularly without fever, is related to actually structural abnormalities. So from the brain scan, actually they can help us look at whether the brain have been formed normally since young or since birth, and also whether there's any very subtle abnormality. Sometimes brain scan may help us to look at even more serious problem, which can cause things like brain tumors. Of course, other things include bleeding, excessive fluid, scars in the brain also will be picked up from the brain scan. There's also one question always the parents will ask, whether a brain scan is safe for children, particularly young children like just newborns. And literally, we need to look at the choices of the brain scan. There are two choices. One is called CT scan, one is called MRI scan. And CT scan, the pros is that it can be done very quickly and it's actually less costly. But of course, the cons is this is actually the scan involves radiations, and sometimes you may not look at very details of the brain. Versus if you look at the MRI, nowadays actually we try to do MRI for the child if possible, because the good thing about the MRI scan is involve no radiations. At the same time, there's great details of the brain structure itself can be seen very well from the MRI. But of course, the cons is that because MRI is time consuming, your child may need a bit more stations or so-called sleeping medicines to let your child so as it won't move during the scan. And of course, at the same time, it's a bit more costly compared to CT scan. If I have a choice, I usually will do MRI for any children with fits. So after looking at the investigation that the child, doctor may order for a child with fits, of course, now the questions always we need to actually answer is that how will we treat these recurrent fits, particularly when a child has been diagnosed as epilepsies? These are the four important mainstays of treatments, but until today, medication is still the most important treatment modalities. And after that, there are other choices, including a special diet treatment, a nerve stimulations, or even surgery and operations. These are some of the points about medications. Most of the times, we don't start medications after the first episode of seizures, particularly those without fever. We only start after the second episode. The reason being because after the episodes, the likelihood of recurrence for the subsequent fits is actually higher. Of course, when we start medications, you always need to know what are the benefits versus the risks while we're starting medications. The benefit of starting medications is basically to prevent the recurrence, particularly those prolonged fits. At the same time, it will actually prevent injury or choking during the fits. Sometimes it's actually based on social considerations. Like if a child stays far away from the hospital, it's actually very important for us to prevent the recurrence of seizures, then the benefits of the medication outweigh the risk. If you look at medications wise, of course, there are risks as well because all medications are not without side effects. So once the medication needs to be started, the parents or the doctors need to be very aware of the side effect of medications. These are just to show you that there are many medications for fits or epilepsy in the markets today, and literally there are more and more coming up. But how do doctors choose the medications? That involve really very careful considerations. So at times, definitely you may need a so-called neurologist or those specialized in brain and nervous system to choose the best medications for the patients. And essentially, this depends on five important factors. What are the seizure types and patterns? The patient factors, the age and genders, any concurrent diseases, and also the medication factors, the cost, the formulations, the side effect, are also about the socio-economic factors as well. Other important pointers about medications for epilepsy or fits is that we need to understand medication is just the control, not the cure. What does it mean that? For example, when we are sick with the lung infections, we'll give you antibiotics. And usually after you're taking a course of antibiotics, you actually get cured from the infections. However, when you use seizure medications, literally we actually use the medication to suppress the abnormal discharges from the brain. If the discharges was due to a brain structure abnormality, the medication will not cure the brain abnormality. In fact, it just prevents the abnormal discharges so that we will not have any fits further. So which means that when the medication was started for the seizures, it needs to be taken every day and of course for a certain period of time. And at the same time, we try to use the single medication as possible. We started with a low dose and gradually increase. And sometimes you may need a second or third if the seizures are not well controlled or if there are side effects. And these are other types of treatments for epilepsy, including a so-called special diet. It may include a ketogenic diet, a modified Atkins diet, and etc. And literally this diet, if you look at it, the normal diet actually is consisted of high carbohydrate together with adequate fat and protein. But versus, in contrast to ketogenic diet, literally it is a high fat diet with adequate protein for growth and also very low in carbohydrate. And this is just an example of a ketogenic diet by which it consists of a very high fat in the diet itself. So next thing is vagus nerve stimulations. And basically this is another modality. Sometimes we use it to treat very difficult to control epilepsies. And this vagus nerve is one of the nerve connecting to the brain. And we put a wire with the machines, a small gadget here by which there is actually a gradual or consistent stimulation of the nerve. And in fact, this may actually work for certain group of patients with very difficult to control epilepsies. And at times, operations may be used, particularly for those patients with scars in the brain, any abnormal structure in the brain, or even the growth in the brain. And if you really the epilepsy is caused by these scars or structure abnormality, when we actually sometimes excise this scar or even a brain abnormality, in fact, this is the only way we can consider as cure from epilepsy. So next is what should we do as a parents if your child has fits? And during the episode of fits, important, do not be panicked. Find a safe place first for the child. If there's any tightening clothing around the neck, you try to loosen it. Please try to turn the child to the safe position, a side position with the head lower than the body. Try to cushion the head if possible so as there's no injury to the head. And if there is any vomiters, secretions from the mouth, try to wipe it. Do not insert any objects, like even your fingers, into the mouth, because that may cause more injury to the mouth and in fact sometimes may obstruct the so-called breathing area as well. So of course at the same time, do not give any fluid or drugs during the episode of fits. Try to stay near to the child until the seizure stops. And try to comfort him or she or he when he's recovering. But if you think the seizure is not going to stop more than 3 to 5 minutes, and it's very important for you to insert a so-called rectal medications to the anus. And this is the way how you should insert the rectal so-called diazepam. And this is actually a very important rescue therapy. And usually we use it when the seizure is more than 3 to 5 minutes. If it's less than that, usually they stop themselves. They no need actually to put in the rectal diazepam. And you know that one tube is actually 5 milligrams, half tube 2.5. It depends on the doctor prescriptions. You may need to insert half or 1 tube. And if your child is actually less than or equal to 3 years old, please insert only half of its so-called nozzles into the anus. By more than 3 years old, you need to actually insert until the end of it. So after that, you need to twist and open the cap from the nozzles of the rectal. diazepam. And if your neurologist or doctor only prescribe half the tube, you can either empty half the tube first before you're inserting, or you can actually press only half of the tubes during the insertions of the nozzle into the anus. And as I mentioned just now, you should have laid the child on his or her side and slowly actually insert through the anus, squeeze the content, and after that remove the tube from the anus without releasing the pressure. Important thing is when you compress it, you're not supposed to actually release it because the medication may suck out. So you compress it after take it out. And at the same time, please hold the buttock together for 3 to 5 minutes to prevent the leakage. And do not administer more than the prescribed medications, doses of medications at any one time. So next, what other things that you should know if your child has epilepsy? It's very important for you to keep a so-called FITS diary before, during, and after events, including the type, description, duration, and triggers, and what the medications. Also, there may be some child lifestyle adjustment that need to be made, including no cycling in the traffic, no climbing spots, no swimming unsupervised, the home adjustment including the better use of shower than a basin for bath, because when do you have a basin for bath? Occasionally when the child throw a fit, a child may get drowned. Of course, it's always advisable to ask the child not to lock any doors like for the bathroom or bedroom. And if the epilepsy were to be very photosensitive, which means that if you have a flash of sunlight which may provoke the seizures and fits, then it's always better to watch the TV in a brightly lit room. Other thing including you need to avoid sleep deprivations. You need to have enough sleep. The child need to have enough sleep. You shouldn't have too much exercise, not too much exercise, excessive exercise to be too tired. Of course, avoid caffeine or alcohol drinks. The parents also need to know emergency treatment for seizures. The school also need to be informed. And if the child to be prescribed or seizure medications, please be compliant with the medications according to what the doctor prescriptions. Do not stop the medication by yourself, because most of the time when you stop the medication by yourself, it may actually trigger the epilepsies. And also, usually the medication will be used for at least 1.5 to 2 years seizure-free period. And after that, will slowly taper off. So these are the few take-home points that I would like the parents to remember. These fits and funny turns are not uncommon in children. They commonly present as either abnormal movement or change in the awareness or consciousness. When your child has this episode, first of all, the doctor will like to ascertain whether it is truly fits. If it is a fit, whether it's associated with fever or without fever. If it is a fit with fever, it's always very important to make sure this is not brain infections before diagnosing as a fever of fits. Of course, when you have fit without fever, there are multiple causes, and at the same time, if the fits without fever happen in a recurrent manner and is unprovoked without triggers, then the child may have epilepsy. And when you see a doctor with these fits and funny turn, doctor will need to take history from the eyewitness, review the videos, examine your child. Some tests may be ordered, including blood and urine, EEG, or brain scan. And there are many ways actually treating epilepsy, but the mainstay is still the medications. And parents of children with epilepsy will need to know the acute management, as I mentioned just now. Of course, there are the do's and don'ts during the episodes or during the care of the child with epilepsy. So with that, I would like to end my presentations. I'm happy to answer any questions if you have one. So to carry on with the sessions, actually we have received some questions prior to that. Yeah, the first question is actually what are the common triggers for epilepsies? I mean, as we know, even though epilepsy happens in an unprovoked manner, sometimes it may be triggered by certain conditions. Let's say like when your child is unwell, when there's a sleep deprivation, inadequate sleeps, or sometimes when the child is too tired. These are the events or these are the conditions sometimes the fits may happen. Of course, if your child already been prescribed with medications, if you actually reduce the dose by yourself or stop the medication abruptly, and sometimes this also may trigger epilepsy as well. So these are an important message to the parents, and so as we can watch out for the triggers and in fact to reduce the recurrence of the epilepsy. The next question is, wow, that's interesting question. So can epilepsy be cured? Frankly speaking, as I mentioned just now, epilepsy can be due to many causes. It depends on the underlying causes. If, let's say, this seizure, recurrent seizure, is actually caused by a brain tumors or growth or scars, if the operations actually have been taking out the place of causing the seizure or abnormal discharges, and by then, sometimes these parents or this patient will be cured because the focus or the origin of the abnormal discharges have been come out from the brain and you may no longer have any more discharges. At the same time, some seizures of epilepsy called self-limited epilepsy or used to be called idiopathic epilepsy. And this group of patients occasionally, after putting on medications for a few months or years, their brain actually may heal by itself. And in fact, after that, we may actually able to cut down the medications and achieve long-term remission as well. So under these two circumstances, we have people call it a cure. And for some of the group of patients, like when you have a child with a head injury by which operation is not feasible, and you may actually sometimes take medication for lifelong, and you cannot say this group of patient can be cured. And there's a live questions. Yeah, also one of the questions from my old patients from Medan is actually from Matthew Ferrani. So, I mean, he's actually currently on the medication called phenobarbital. So, in fact, I think, yeah, it can actually be taken as twice a day. That medication should be fine twice a day. So, it depends on the seizure control at this moment. If it's still actually seizure very well controlled, you can carry on the medication twice a day for this 10 milligram twice a day. That should be fine. Yeah. Just look at some of the questions that they have previously. I mean, the prior to these sessions is, what do I do if my child is having a fit? Yeah, that's actually try to repeat whatever I said just now, because this is very important circumstances that parents need to be able to handle. So when your child is having a fit, remember the first thing, do not be panicked, because most of the time we know it is a very scary experience to the parents. So find a safe place for the child. After that, please lie the child on the left side or right side down, that should be fine, on the one side, and please do not put anything into the mouth. Stay close to the child and try to time how long the seizures carry on. If it were to be actually prolonged more than 3 to 5 minutes, most of the doctors may have been prescribed the so-called rectal diazepam for you, and please insert as instructed like my previous video. And the next question is also different patterns of seizures. Yeah, I mean, as I mentioned just now, the seizure can actually present very differently, because as we know that the seizures actually arising from abnormal discharges from the brain, and our brain control many functions of the bodies. Among the important patterns of presentation, they may present with abnormal movement, they may present with abnormal sensations, or sometimes even some visual or eyesight disturbance. And besides that, they may present with just like impaired awareness or consciousness, which means that they are not responding for no reasons. And at times, some children actually may present abnormally, and in terms of the changing in the heart rate and also the blood pressures. And these are the common important presentations. And sometimes what is more disturbing to the child is that the child may just present the abnormal behavior, at times even during sleep. So there are many patterns of presentations, and it depends on the origins of the abnormal discharges. So if you're not sure, it's always good to take the video for the abnormal events, so as you can discuss with the doctors or neurologists whether it could be a fit or not a fit, or just a fit mimics. The next is actually the questions somebody is asking about how long do I need to take medication for epilepsy. Yeah, as I mentioned, a medication for epilepsy is the control, not the cure. When it means that control, which means that you need to actually take every day as instructed and also for a certain period of time. Most of the time, the general rules of time is probably like 1.5 to 2 years, but sometimes some of the self-limited epilepsy will be actually like just giving about 1 year. So it all depends on case by case basis, depends on the attending neurologist, and they will decide based on how easily the seizure be controlled, what is the underlying cause, and at the same time, when was the last seizure period. So when we say 1.5 years, actually you're counting from the last seizure, which means the fit-free period. So this is another very challenging question. My firstborn have epilepsies. Will my second child get it too? Yeah, I mean, this is actually very challenging questions in a way that, yes, certain epilepsies, they may be genetically inherited. So it's always very important for a neurologist or a doctor attending to this child to assess what exactly the underlying cause of the epilepsy. So if the doctor believes this is actually related to genetically abnormalities, he or she actually can do some genetic tests to determine. And from the genetic test, perhaps from there we will only know that whether how high the risk of recurrence in your second child. And at times, you may actually need to refer your child to a specialist, a genetic specialist, to actually get a bit more idea about the recurrent risk in your second child. But it may happen, but the risk, how high is the risk, depends on what is the underlying cause of what is the abnormality in the genetics wise. So there's another live questions. So from Ms. Umawati, Doctor, what are the causes that may prevent child from outgrowing from febrile fits? So literally just now, as I mentioned, febrile seizures, it happens between the age of 6 months to 6 years. Most of the children will outgrow the febrile fits after 6 years old. If your child still continue to have fits after 6 years old, which means that in fact they may be actually having epilepsy rather than a pure febrile fits. And what are the factors that be actually affecting that? Occasionally, they may be related to some genetic mutations, genetic changes. And that, of course, if your child is abnormal in terms of development, of course, there's a family history of epilepsy, then we may be very cautious. Some of these children, even though they have fits during in the context of fever, after that, after 6 years, in fact, they may actually having truly epilepsy as well. So these are the factors like you have child abnormal developments, you have family history of epilepsy, or if this febrile fits actually related to some genetic abnormality, in fact, some of these fit in the context of fever may persist later after more than 6 years old. So the next question is, what is the difference between seizures and epilepsy? Are they the same? Yeah, basically, I think, as you know just now, seizures are just clinical presentation when you have of abnormal discharges from the brain. And this is how you present externally, like abnormal sensations, abnormal movement, impact of the responsiveness. These are all seizure patterns. But when you have these fits or the seizures which are recurrent at the same time without a triggers, particularly more two or more episodes, then we just label somebody is having epilepsy. So literally, we cannot say whether they are the same. They are not the same. Actually, this is just one of the presentation. The other one actually is a clinical conditions. So are seizure dangerous? Yeah, that is actually very important questions for parents to know. Because some parents may ask me, if I'm not going to start medication to prevent a recurrence, will it be dangerous and hazardous? This actually all depends for a few factors. First thing is what type of seizure is having. Of course, somebody to have a whole body jerk and stiff with a bluish discoloration of the mouth, that's actually very dangerous seizures. Of course, versus somebody just have a blank spell or some minor jerks, that probably be less dangerous, but despite so, you cannot say it's not dangerous as well. So to me, actually seizures are dangerous because there are a few reasons for it. The first reason is actually if we were to have a prolonged seizures, let's say more than 3 to 5 minutes, sometimes that will actually impact the way how we breathe, and that will actually cause a lack of oxygen to the brain. The secondly is that when you have a seizures, sometimes you may actually have a vomitings. When you have a vomiters, you may potentially get choked. That actually will actually obstructing our airway and our breathing as well, and that will cause immediate danger to the child. And the next danger point about a seizure is because when like a child during swimming, it throw a fit. Even though the fit may be short, but it may potentially get drowned during the episodes. And which means that the seizures itself may pose a safety issue for a child. So it means this another way seizures are dangerous as well. So the next is do people who have epilepsy also have developmental disability and psychological difficulties? Yeah, this is always a question that the parents may actually want to know. Epilepsy, again, it comes to the cause of the epilepsies. It depends on the underlying disease that leads to the epilepsy. some children have epilepsy may have developmental problems. So there are two possibilities. The first possibility is that you may have a brain disorder which causes epilepsy together with developmental problems, or at the same time, sometimes some of the serious epilepsy also may cause developmental problem to the child. So this is actually there are two ways how epilepsy is correlating with developmental disability. And of course, to me, definitely epilepsy will cause a lot of psychological difficulty both to parents and also to the child. I mean, I have a parents who have a child who have epilepsy on and off. You know, they have a sleepless night at night because always the seizure may happen during sleeping. And of course, this will pose a lot of psychological stress to the parents. So the good control of seizures definitely will reduce and ease these psychological difficulties. At the same time, for adolescent girl who have actually seizures, and it may have so-called abnormal strange episode in the school, and it may get stigmatizations in the school, and that definitely will pose a very important psychological impact to the parents as well. I mean, to the patient itself. Of course, there are many other causes and many other psychological difficulties that they may face, including they may have anxiety problem because of the fees ongoing, may have some depressions issue. So definitely treating epilepsy is very important to reduce the psychological difficulty as well. So we have another live questions from Medan as well. Epilepsy boleh bagi vaksin imunisasi. So generally, there's no contraindications for those who have epilepsy to give a vaccination because that's actually very important. Of course, you need to be careful during vaccination. Sometimes a child may have fever, and of course, that may actually trigger the seizures. But general rules is actually there's no direct contraindications for epileptic child to continue with the vaccination programs. So the last is actually what are the signs that my child epilepsy is becoming worse? Yeah, that's actually very important. Sometimes a child already been actually very well controlled seizures. We need to recognize what are the signs that potentially the child is actually having more difficult to control epilepsies. I mean, of course, the most obvious thing is that let's say this child already on no seizure, is started to present a lot of abnormal seizures again, or sometimes the seizure may just change pattern. You realize there's something not normal, the Huntington's is getting a bit more, then we be very cautious. Of course, the other way to look at is when the epilepsy will get worse, sometimes we may miss the episode because sometimes it may be quite subtle. So what other things we can observe is for no reasons, there are no other reasons to explain why the child doesn't progress better or just get arrested. Or in worst scenario, sometimes they will even get worse like so-called regression going downhill. So when I have a developmentally abnormalities which is not present before and suddenly get a bit more or it become worse than that, then be careful. Sometimes you may miss some of the seizures. And the other thing is when for a school-going children, it's very important to see how the learning. Sometimes the child may have night seizure, may not be picked up, and its learning may get downhill and getting worse. So that actually may tell us that perhaps whether the child is actually getting worse into epilepsy, then we may miss some of the seizure at night. So these are the things that perhaps we need to actually observe so as we have a better monitoring and control of the progressions of the epilepsies. I think these are the last questions I have. And important things that the last measure is a brain condition shouldn't put your childhood on pause and of course on hold. And they should actually, epileptic child should like to live a life with dignity and of course to live a life with quality as well. So I think with that, I would like to end my sessions. I hope you enjoyed the session today. Thank you, everyone.